Welcome, everybody, to the annual meeting of the Board of Directors. The introduction is you're putting your name in the chat. And do we have any public who would like to share any public comment? Okay. Noting the silence, we will move on. Ms. Bainey.
Here I am.
There you are. So have you prepared for us a patient story?
Absolutely, I have a patient story. And I am going to just start with a quick overview and reminder of what your Council of Governments in the region provides as service. So the story today is going to tie together some of those pieces. But aside from transit that many of you are aware that we provide in the Tri-County area, including the Confederated Tribes of Warm Springs, you also have likely heard recently that we have been partnering with the counties and chambers in the state to, we have a community and economic development department. And that department so far has put forth into the community about 600 small business grants. And we are about ready to, we will have likely close to 1,000 additional grants that will be awarded here soon. In addition to that, we also have WorkSource, which is a partnership with the state of Oregon. And that is a department where we have employment counselors. They do job skills training, reemployment, rapid response for layoffs. And then that factors into also that we have a youth work program, and that's for 16 to 24-year-olds. We do job skills training, mentoring, and they also get a paycheck for doing that work as well. For many of them, it's helping them with their families. And that links into our youth education program. We operate alternative high school education for in partnership with our school districts in the High Desert ESD in Prineville, La Pine, Sisters, Bend, and Redmond. And last year we were able to, outside of the credit recovery for a number of students, we were able to assist with over 200 GEDs and diplomas in the region. So today's story is from one of our employment counselors, and his name is Ryan. And so I'll just read it. It's in first person for him, but so he wants to talk about the partnership with East Cascades Works, DHS, and the Prineville Humane Society of the Ochoco's Thrift Store. And the names that are being used are not the names of the individual. In April, East Cascades Works was given access to distribute $5,000 worth of layoff aversion grants to support local small businesses in Central Oregon impacted by COVID-19. And he was part of helping the EC Works distribute those grants and to provide rapid response outreach and resources to employers. And I will let you know that our small and mighty team of 9 were able to outreach to over 800 businesses in the Tri-County area. That helps us to be able to, in some small way, quantify what the need is so that we can assist the state in letting us know how much money we need, which is a lot. So the focus of his outreach was on some of the smaller communities in the area. And I immediately thought of Humane Society Thrift Store in Prineville. Humane Society Thrift supports the animal shelter, and they're a nonprofit charity thrift store run by a handful of employers and community volunteers. I work mostly with clients referred to me by DHS who are currently receiving TANF benefits, and Humane Society of the Ochoco's Thrift Store is a primary volunteer resource for the DHS Jobs program in Prineville for supported work, work experience, and Jobs Plus, which is a full-time 6-month temporary position subsidized by DHS. I requested that Humane Society of the Ochoco's Thrift would be considered for the grant, and it was approved to send them the application. I assisted them with the final review, and they were approved by EC Works the next day for the $5,000 grant. The grant allowed them to cover their initial payroll and the PPE needed in order to practice necessary steps to protect employees and their customers from the COVID virus. It also allowed them to reopen to the public sooner and open 5 days a week instead of part-time. They were able to bring back all of their team members, which included our 2 work experience volunteers that were there before the shutdown, and they immediately promoted my client Molly to the Jobs Plus position. Because the site was able to act swiftly and open their doors early, they were flooded by donations and increased business. They've had record sales since reopening, and sales were so good that on the site that they were able to promote Molly to a full-time benefited position 4 months early, and also promote their work experience person Alex to a Jobs Plus position and plan to hire her January 1st. The story doesn't end there. Molly is a survivor. She's a survivor of domestic violence, addiction, homelessness, and significant mental health concerns. In the time that she's been there, she's been able to volunteer and then become employed, get a current ID and driver's license, a car, and graduate from her counseling program. Then 2 months ago, Molly's application for a low-income apartment unit was denied because of her background. But with the help of her supervisor and myself, we were able to put together some reference letters, which reversed her denial notice, and she is now able to have safe and secure housing. This December, she's been offered and accepted a supervisory role. Honestly, one of the greatest outcomes I see with Molly is that she has her confidence back, and this wouldn't have happened without such a great network of resources. So there's our story.
Okay. Okay, thank you. And then Jen, I think you had an announcement you wanted to share.
Yeah, thank you, Rick. Hi, everyone. I hope folks are having a good day. I wanted to share an announcement with this group that will be coming out later today, at least internal to St. Charles, but we work so closely together. I wanted to share it with you myself. So after a lot of thought and consideration, I have made the decision that it's time for me to write the next chapter in my career. And so I am going to be leaving St. Charles at the end of July. So it's a long time from now, but we're going to start the recruiting process for my replacement. I have a strong desire in the next phase of my career to hopefully teach at the university level. I want to teach accounting and finance. I have a theory, Rick, that if I use the term bucket enough, I can create and cultivate a huge amount of future finance leaders that people can understand and talk to. So I'm going to take my learnings from a career so far that has about almost 28 years of finance and accounting industry experience and hopefully translate that into teaching at some point. I'm also looking forward to spending a little bit of flexible time with my husband. He has a more flexible schedule than me, and we want to travel and do some other things. So I've had the honor of working at St. Charles for over 11 years now. I'm filled with gratitude for all the opportunities I've been given, all the missteps that you who have more experience in healthcare have helped me overcome with hopefully some learnings and humility along the way. And I'm not going anywhere. I'm still going to be full tilt Jen working for the next 7 months, but we will be seeking a replacement for my role. So I'm also rolling off the board of the Health Council because of a conflict that I have that doesn't allow me to participate at the level that you would all need me to. So Donna's working with Joe to have the appropriate St. Charles leader join you guys next year. So this is my last meeting. It's not my last time in Central Oregon, but that's what I wanted to share, Rick. Straight from the horse's mouth.
Well, I'm sure I speak for many other people that you will be sorely, sorely missed in many of these meetings. You just have brought a huge wealth of sort of practical knowledge, passion for the work, not just for the numbers, but what the numbers mean underneath, and really can connect things in a really human level, and still be able to see the broad policy issues. And so just you've been a gem and a real rare resource for us. So I just hugely will miss you and in these roles, and no doubt there'll be tears on my pillows tonight.
Oh, I doubt that, Rick, but thank you for those kind words. You've taught me a lot too. I know much more about behavioral health. And I know that you've made me a more compassionate person. I've grown beyond just an accountant over the years.
More than you ever wanted to know, no doubt. Okay, and there are chats from folks
Thank you all so much.
and very warmly and richly deserved comments.
I have many memories. I think the first time I asked Divya a clinical question, it was like, and I still don't know, EOTH? Is that alcohol? I asked her.
It's funny, that's the first memory that just came to my head too. As you were saying that. I was like, Jen, maybe now you can step away from the quality role.
I've had a lot of learnings over the years. That's funny that you recall that too. Oh.
No, but really, you will be absolutely missed, and a huge loss for St. Charles and our community in general, but a gain for the students, so that's awesome.
All right. Okay, thanks, Rick. You have your agenda back. Thank you for that.
Okay. So next one are the action items and the approval of the consent agenda. Any comments on that before we go for a motion? So silence. So can I hear a motion to accept the consent agenda?
I move we accept the consent agenda as prepared.
Okay, a second.
Second.
All in favor, say aye or signal thumbs up with reactions. Okay. Those opposed? Okay. It passes unanimously. So Donna, it might be better if you carry on the next item under governance.
Yep, no worries. I'm sorry, I was distracted for just a second that there's a ginormous deer, a doe, like right outside my window. This just never gets old for me, this California surfer girl. It just never, ever gets old. So sorry for that. The reason that Rick had mentioned that this was our annual meeting as we opened, because our bylaws indicate that we will do our slate of officers voting at our annual meetings. And so there you go. We followed our current process where you all received an email asking you for nominations. I did secure agreement from our current board officers, Rick and Linda, that they were willing to run again. And then the votes were tallied, and it was unanimous to keep Rick and Linda in the chair and vice chair positions. And so those slate of officers come before you, Chair Rick Trelevin and Vice Chair Linda Johnson, for a vote today.
See, the crowd's going wild right now. You can hear it.
Yeah.
Apparently so. So I think what I'll do, since you are the chair, if you're not opposed, Rick, is that I will open the floor for a motion to approve the slate of officers as presented.
So moved.
Second.
All those in favor, thumbs up, say aye.
Aye. Those opposed?
Sorry, Rick.
Okay, I see I have no friends on the committee. I was
You have your
hoping for
new
some opposition
2021.
votes, some competition here. Someone please. Or even
I don't
Linda. I mean, Linda, you could stage a coup. I'm all in favor of it.
That's not in my best interest.
Congratulations to our 2021 slate of officers.
Thank you for the opportunity to serve again.
Thank you again for your trust in this. Linda, bylaws and Senate Bill 648 update.
Yes, I'm going to hand it off to, before we jump into the bylaws, I think we wanted to update people on where we are with Senate Bill 648. So I'm going to hand it off to Donna for this.
Great. So after the board approved the changes and edits to Senate Bill 648 last month, Tammy and I and Linda met to propose next steps of how we were going to get the Senate bill in front of session coming up. And so we created a clean and a red line copy of the Senate bill. We have a host of legislators that mostly Tammy's reaching out to. I have a very small number. Tammy has a really big number. And reaching out and actually making phone calls and emails about, what our intent is to refresh folks on what Senate Bill 648 is or was and what we want it to be. And then our plan following the feedback, and I owe Tammy a call probably here on that, is to hold a luncheon of sorts, a virtual luncheon, so that we can bring education to all of the legislators, including new legislators, on what it means to be the Health Council and how Senate Bill 648 was created and why it was created. I'm just going to ask Tammy, do you have any updates that you want to share?
So I started my outreach this week, which has been light. So my apologies for the delay. So I haven't heard anything back yet, but it's pretty, as all of you know, there isn't a whole lot there. It's re-educating those that had been a part of this in the past. I know that we think that it's of big importance, but they've had other fish to fry recently in the last, since we had this in front of them. So it's part re-educating and part for those that are new, helping them to understand that we are set up and structured differently and the reasons for it. I don't anticipate any concerns. We haven't had concerns in the past. It's more just that education piece and then the reminder.
Great, thank you very much. I do, when I did reach out to Director Allen, of course, clearly with his hands full as well, he asked if I would meet with Holly Hybert and Jeffrey Scroggin, who I've talked to in the past, which actually was really encouraging to me that they actually want to hear about it yet again. So we will carry on and keep the board abreast of what we're doing in that space. Thanks, Linda.
Thank you, Donna and Tammy. It's fun to be helping and moving this process along. Okay, to bylaws. We ended last month's meeting with a discussion on sections 3. And now we're ready to move to section 4. And the remainder of the document will go pretty quickly, I expect. And so if we can just walk through this document. And if you have a copy of the bylaws with you, great. If you don't, I'll just tell you what those sections are. One of the things, section 4.1 deals with the officers of the board. And there were a couple of challenges that we encountered right away. First of all, being that the titles of the heads of the council or the board were designated differently than what we have in practice. So everywhere where it says president and secretary, which were the two officers identified at the board, we have in practice and now in name suggesting a change to chair and vice chair as our current practice is, and the secretary will deal with in a few minutes. We didn't change the election period for the officers, and today, as it was in the existing bylaws, and we continue to recommend, that the officers are elected annually on the date of the annual meeting. So next in section 4.3, it pertains to resignations that are submitted to the board in the old language, and we're recommending a change that it be submitted to the chair and the vice chair. So very small technical change on that one. So we're on section 4.7 now, which does not exist any longer because section 4.7 dealt with the powers and responsibilities and duties of the executive director. And in the old bylaws, and in the new bylaws, in the next section, section 5 deals with staff. But we had the president and secretary not listed in the staff section, but listed in the board officers section. And so it was really confusing to have those responsibilities and titles in two different locations. So what used to be the president is now the executive director. And that executive director has been moved out of the board officers paragraph and into the staff paragraph. And section 4.8, which dealt with the secretary, who was Kelsey, who was also in the old bylaws a board member. The secretary section has been eliminated altogether. And let me talk about why. In this governance model that we have, the board has responsibility for everything, and certain functions and activities and responsibilities of the board are accomplished by delegation to the executive director. And one of those delegations would be ensuring that we have all of the meeting minutes that are required by our bylaws, by state law, and all of those functions are accomplished. And so Donna, as executive director, has responsibility to make sure that happens, and she will do that. And so we don't need to spell out how that's done in the bylaws. Now, there will probably be more specificity on some aspects of how she is to execute some of those responsibilities in the policy book. But the delegation piece and the scope of her work, which includes the old secretarial functions, are moved to the staff section. Now, I suspect Donna will still have Kelsey do that work. And so the execution of it won't change, but just how that's considered in the bylaws is a change. Is there any question about that? No.
Linda, could I just add, in the committee going through it, I think what I learned was the way the bylaws were written were for a corporation, an LLC if you prefer. So this section actually wasn't board officers. We changed it to officers of the board. It was corporate officers.
Mm-hmm.
And so it was very confusing to those of us who are used to 501c3s and not corporations. And so a lot of this is cleaning that up and making it fit more what we've created already, and having it be the governance model that Linda mentioned, policy governance model that we're trying to move toward.
Thanks, Paul. So section 4 now ends at section 4.6. Nope. Yes. Then we move on to section 5, which has the new addition of the executive director roles and responsibilities, just the shift of that paragraph. That's it for section 5 changes. Section 6. Section 6 deals with committees and councils. We recognize that in practice, we have committees and we have councils, and some we have a standing, some are ad hoc. The bylaws, the current form of bylaws, in some places doesn't mention quorum, but in other places does. And so we tried to streamline that under the paragraph of committees and councils, whether they're board designated councils and committees, whether they're committees that are mandated by law, or whether they're ad hoc committees that we pull together for a specific purpose, such as accomplishing the work of the Regional Health Improvement Plan. And so this section, it clarifies that. So first we changed the title to committees and councils to distinguish between committees of the board, such as nominating committee, and the councils which serve the board, including the provider engagement panel, the CAC, and the ops council. Then in section 3, we clarified language about quorums, consolidated, that's actually a new section that reads for quorums for each committee and council, the act of a majority of the members present at a meeting at which a quorum is present shall be the act of the members. So it defines quorum in the amount of positive vote to pass an action. Then section 6.4, we just updated the name of the operations council to be consistent with, or ops council, if you want to call it that. We added, in that section, we added a representation from the Diversity Coalition. And we changed community representatives from a must to a may. So that's an option. If we feel like the makeup of that committee needs or requires more community visibility or more community representation, they can always do that. On section 6.5 deals with the CAC selection committee. The selection committee for the CAC is mandated in CCO 2.0, so they have a different selection committee process than we have for all of the other committees or board members or board officers. So this paragraph 6.5 is as a result of the legislative mandate. And then in 6.6, we changed that paragraph to be much more flexible so that it's explicit that as OHA changes its requirements, that the council will respond. Let me see the sentence that pertains to that. We talk about the number of members. 6.6. I'm not actually seeing that language off the top of my head. Do you see it, Donna, in 6.6? Oh, 6.6a. Yes, I see it. The exact number of members who must be on the council are 12, not less than 12. And at all times will meet the membership requirements specified in legislation and or mandated by the Oregon Health Authority. And we struck most of the rest of the paragraph. And we added this, or we kept the sentence that says members of the Community Advisory Council serve at the pleasure of the CAC selection committee. We deleted the requirement in our bylaws for a member of the provider effectiveness panel or provider engagement panel to sit on the CAC. It's not a legislative requirement. And we removed the requirement that a member of the ops council sit on the CAC. They may choose to, we may choose to have them, but it's not a requirement. And then we, in section 6.7, changed the name of the clinical advisory panel to the provider engagement panel. And I think that wraps up the sum total of all changes we made to the remainder of the bylaws. Donna, did I miss anything or any feedback or input from the governing committee?
No, I think you got it all. I was following right along.
So we offer this for your consideration for changes, and it should come back next month for further discussion and a vote for approval.
So any discussion or feedback from the board members to the governing committee?
Hi, this is Brad. I just had one.
I'm sorry, Brad, I can't hear you.
Can you hear me now?
Yes.
Okay, I think there was a delay. Hi, everybody. I just had a point of clarification on item 6.4.
Okay.
When you refer to a diversity coalition, what are you referring to there? Is that Cody?
In this instance, it would be Cody, Brian.
I would just say we'd be more specific there. I mean, that sounds like something other than Cody to me. I don't think Cody is a coalition, it's a work group, right?
Yeah, and I think the diversity coalition, there was a diversity coalition before, and that's where the language came from. So I appreciate the call out. Thank you.
Okay.
Do we want to name a specific organization, or do we want to make it more general, an organization representing diversity activities or actions?
Yeah, because we do have several in the region. We can work on that and bring it back or send an email out.
Thanks, Brad.
Sure, yeah.
Right, so Brad, I think the issue and your input would be super helpful in this is, bylaws hopefully should last for a long time. And so try to write the sections pretty general, and then organizations may change and morph and we reorganize into something else or whatever. And so so today is Cody and it might be something else in 5 years. So just sort of thinking that through and what would be the best language to balance those two forces. And so think that through, give your input to Linda and anybody else. I mean, this is a common problem of bylaws that we're trying to solve.
I think that completes it for the governance committee report.
Thank you,
Okay.
Linda.
And I'm not sensing a rousing swell of comments about governing bylaws. I know that's the most exciting stuff that we cover. And many of you stayed awake many a night worrying about the outcome of this, but luckily we're in good hands.
And just to give the board a heads up, the next piece of work for the governing committee is to start to scope out our policy manual. That will be even more exciting.
Okay. So this one is Brad, you're up, and this is the Cac Chair Report out, and there's an attachment to this.
All right. Can you hear me?
Mhm.
Yes.
Okay. Well, yeah, thanks for the opportunity to share with you all the work that the CAC did, the Community Advisory Council did to distribute $950,000 in community benefit funding. It kind of took, I think it took most of us CAC members by surprise that we had that much money to distribute. It always feels good, of course, to be a part of distributing funds. But it was quite a bit of work to review what ended up being 42 applications here in Central Oregon. And let me go through, Michaela was nice enough to prepare some kind of talking points for me. So for those of you who aren't aware, the Community Benefit Initiative is a requirement that the coordinated care organization has to spend 10% of the 1% given to the Health Council for community impact funds, regional health improvement plan funds. These projects have to address social determinants of health and equity and align with the regional health improvement plan. So normally that would be $250,000 for the CAC to distribute, the Community Advisory Council. And those need to be distributed by December 31st of the year that they're received by the CAC to distribute. The coordinated care organization is also required to invest 10% of the 2020 quality incentive measure dollars with withheld for projects that address social determinants of health and equity. This turned out to be an additional $700,000 this year, which was added to the CAC's, the Community Advisory Council's pool of funds, bringing our total to $950,000 to distribute. So the CAC, and I would say really the Health Council staff, I don't think we as members of the CAC can take credit for developing our RFP, request for proposal process. The staff really took care of that. Of course, the CAC had input and provided feedback and so forth. But I thank the staff for really doing most of that work, the heavy lifting. But nonetheless, we came up with an RFP process and a scoring matrix, and you're looking at kind of the results of the matrix is what you're looking at on the screen there. And the CAC decided, the members decided to prioritize the projects that have the most impact addressing social determinants of health. So you see on the right, there's 1, 2, 3, 4, 5, 6, roughly 6 columns there of social determinants of health kind of categories within that. And as well as health equity, health disparities, barriers to access, inclusion, demonstrated project need, and service to rural communities, so that not all of the funding was going to Bend or even Deschutes County, that we were sure to spread it out across our region as equitably as we possibly could. Overall, so again, 42 very worthy applications were submitted, and the total ask from those 42 applications was $1,669,956, so almost $1,670,000. And again, we had $950,000 to distribute, so there's a significant difference there of almost right around $700,000. And so that required us to make some tough decisions, which is never fun. It gives you an idea of what foundations and other grantors go through when they try to make decisions about who to fund and who not to fund. In the end, we had 2 rounds of our CAC members participated in 2 rounds of review over a couple of months in roughly, I think it was August, September, October, around there. And lots of discussions, and we ended up narrowing it down to 23 projects, which you see on the screen, which I know the type is very small, so I don't expect you to actually necessarily see the detail, but I believe this is in the packet, correct? The board packet. And you can see the amounts there. You can see if there's an X highlighted with a color that indicates that the organization applying for funds indicated that they served the geographic areas which are in the light blue there. And then the dark blue highlighted areas with X's are the social determinants of health. So again, they indicated to us that their project covered those specific social determinants of health and those geographic areas. And only in a few cases, I think we kind of questioned whether or not that was true, but we decided we didn't have the capacity to to get into that. So ended up being mainly an honor system, trusting that what they're telling us is true, and then kind of looking at of course the detail of the projects that they were proposing, particularly with reference to the social determinants of health, to see if those aligned. And so we 23 projects, $950,000. That's really, it's a huge impact across the community. So it's, it feels good. I think our CAC members felt really good about the outcome. Again, I want to thank the staff for putting together these fantastic visuals for us, just putting the data into a format that was easy for us to, as easy as possible to digest and make decisions and then see the outcomes of those decisions. And that's all I have. Do anybody else, either Linda, who's on the CAC, or anybody else, want to make any comments about that process or any questions?
I did I'm not sure if you said it, you may have, Brad, but I did want to call the attention to that the CAC had made a decision about what the scope of the projects would be as far as funding. So, you know, the great, not to exceed $50,000. So I thought that that was very mindful of the group and really gave an opportunity to really distribute that almost $1 million in a really good and fair and equitable way. You all did an awesome job.
I would also add that Don and the staff made, just in a short period of time, designed a process that was not easy, but it was clear and understandable, and gave the CAC an opportunity to define what were the criteria that we felt were important from our perspective that should be evaluated as highly important versus ones that were not. And it was really heartening to hear the values that the Health Council holds also be expressed by the members of the CAC committee. You know, things like making sure we have regional representation, making sure that diversity is addressed, measurable outcomes, questions about sustainability, all those sorts of things that have been priorities here were sort of spontaneously approved and suggested by members of the committee. So it was a good, quick, head spinning process, but it was successful, and I feel that it had integrity.
Okay, any other comments? And Brad, if you're talking, you're on mute.
Sorry, I'm talking to somebody here in my house.
Okay, great. Usually I'm more concerned about people muttering to themselves. Starts me doing mental status exams. Okay, no more comments. And Brad, my comment is it's huge experience for those of us who write grants to be on the other side of that decision-making process. So always helpful. Okay, next, there's a couple people who have joined us. Justin, you're one of them. So if you could put your name in the chat, that would be great. And then there is someone on a phone number, 541-388-6567. Maybe that's Patty, or maybe it's somebody else. But if you could put your name in the chat, that would be great too. Kelsey, were you going to say something?
Just that since that person's on the phone, they're not able to put their name in the chat, so they have to speak up and introduce themselves.
Okay.
Yeah, phone number ending in 6567. Can you let us know who you are? Are you on mute by any chance? We can
Okay.
check back in later. It's okay.
We have a mystery caller. Great. Oh, and here's Muriel. Yes, we know you. Okay, great. And unfortunately for those who, if the mystery caller is someone trying to find out what we do at these secret meetings, we have bored them to death with one of the more boring agendas. So I apologize if you're trying to spy on us. This is not the time to, this is not an exciting meeting to spy on us. I'm sorry. I'll go ahead. CUSC update. And Divya, you should help me with this. So that has been going on. I think one of the things that got highlighted was actually in the contract negotiations this Wednesday. We went over some of the financials and where the spend has been going that has leading us to really end up with a very, very tight budget proposal that we in Finance Committee are still working through to present to the board. And so it highlights the importance of this initiative. And I think we need to, oh, thank you, Brad. CUSC is Cost and Utilization Steering Committee. Good that the co-chair knows the name of the acronym. There's actually some acronyms in behavioral health that have gone on so long that I have forgotten the meaning of them. And I know of some agencies that went by an acronym so long that they just changed their name to the acronym. So no one actually remembers what the acronym means anymore. And so in behavioral health, internally within that subcommittee, we're still having discussions. I think we have more clearly seen that the rise in the behavioral health spend has been in the panel, mental health panel largely. And so Pacific Source has presented some strategies for bringing that under control. And Divya, did you have anything from the orthopedics or other parts of the discussion?
The only other thing, no new update from the ortho subgroup, because we are actually having our 2-hour meeting right after this one. So just the timing is off. So I can give you guys a more of an update next time. I don't think that there's anything additional other than what will probably get highlighted out of the Finance Committee report.
Okay. It is a burning issue that the board should be aware of, is that the budget discussions, we're still working through, but it will be a super tight budget. So we need to make sure we're wrapping our heads around that and implementing strategies that work with that. Okay, any other comments about the Cost and Utilization Steering Committee? Okay, so what we're going to have with the executive session is we're going to be reviewing the draft executive director evaluation that the executive committee came up with. And so how we're going to do that is Kelsey's going to take us all into a separate virtual room, and we will have our discussion there. When we are done, then Linda will text Donna and Kelsey, who will then bring the board back to the full committee, and we'll basically be done at that point. So those folks who are not on the board, you will be left sort of having a nice discussion with Kelsey, I suppose, or you can drop out. Any questions about how we're going to do this? And did everyone get a copy of the draft executive director evaluation?
Rick, I just wanted to clarify that the general board meeting will now adjourn and will not come back into general session following the executive session.
We have a chat before we jump. Justin, did you have anything to add about the Cost and Utilization Steering Committee?
No, just I think we had a subgroup you all asked us to work on. It was Mark Strong, Kim and myself, and then Dan attended, and it was more of a data dive on double payment related issues. So I just wanted to let you know, we met with Donna yesterday as a group. We were able to really walk through and get a better understanding of quite a bit of the contract. And so just, there's nuance to it, and I don't want to bore everyone with the difference in how the contract is actually written or built, but essentially the issue of, are there items that are double paid for, or at the very least create different math between utilizing services through the hospital versus in an outpatient setting. And so the confirmation of that is there absolutely is. And so there are definitive ways that there are disadvantages for taking things to a lower total cost of care area built into the contract. And when I talked to Kim from the IPA, he just wanted me to restate that the current structure of the contract does not support value-based contracting at all. So pretty much a confirmation of what we've been talking about for, or at least I've been trying to kind of talk about for a year and a half now. But so those medical loss ratios and those statistics are grossly overstated for groups like mine, and pretty well understated for other groups that have different utilization patterns. So math is math, and healthcare delivery is healthcare delivery. So I thought, just wanted to bring that back. I don't know that there's a reason for my subgroup to meet anymore. The issue has been confirmed, and now it's really up to you guys in contracting to do whatever you're going to do.
Okay, so with that confirmation, I'm hoping that, expecting that Kim will bring that into the contracting discussion. And you have a clear line of sight into that. And we can talk about that in more detail if necessary in the Cost and Utilization Steering Committee General Meeting. Or the Finance Committee, if that's necessary.
And you all are comfortable with sunsetting the subgroup then here?
Yeah. Any questions about that dive into those nuances there? I think it's important, but I know it's detailing. Okay. So then I think we are ready for the jump into hyperspace or whatever you do.
Yeah, everybody hold on tight. Opening the room